So, and it's small.
It's small,
It's
the size,
nothing to be scared of.
smaller
It's
than
smaller
a
than
penis,
tampon.
right?
Yeah, definitely.
Well, super
I mean,
I hope.
Sharzad,
Yes, Susan.
what comes to mind when I say vagina? Kitty cat, meow.
I think about my privates, my baby maker. I think
Yeah.
about all kinds of things.
Yeah.
It's kind of taboo. I feel like not a lot of people are super comfortable talking about their vaginas.
So you guys, today we're at the offices of Dr. Jennifer Berman. She's a urologist here in Los Angeles. She's going to tell us all about Votiva by InMode.
We're gonna get a little vaginal treatment done. Destigmatize talking about your vagina.
Yeah, because you know what? This is important.
Today I'm going to be treating Susan and Sharzad with Votiva by InMode. Votiva helps to improve feminine health, sexual function, and restore blood flow.
This is exciting.
Vaginas.
We're talking about vaginas. We don't get to talk about that with our viewers. I mean, we talk about it amongst us.
Susan and I talk about vaginas
One of
all
my
the
favorite
time.
topics.
Yeah, yes, of course.
We all have one, right?
Yes. Well, okay, so the big thing is we're getting a little bit older. We're
Susan,
moms.
don't tell anybody.
I know.
This will stay young forever.
I know. And you know, like, we do a really good job of maintaining from here up. I think, like most women, we probably don't do a lot of maintaining down here with our vaginas because we don't really know how to, right?
What's good for the outside is also good for the inside, and I always try to say beauty from the inside out. You know, so if we want to look beautiful, healthy, and feel vibrant on the outside, then what's going on the outside also has to be going on in the inside.
What is a healthy vagina?
Yeah.
A healthy vagina, actually, that's a good question. A healthy vagina, I would describe it as a self-cleaning oven.
Oh,
I
In
like
wow,
that.
I like that. All right.
In its youthful reproductive state, which is what you girls, you ladies both are, it cleans itself, it restores itself, it has blood flow, it has nerve supplies, it has elasticity, it has a pH, it has antibacterial properties, it has antifungal properties. So a healthy vagina is an ecosystem, basically. There are women that want to restore, improve, and maintain the ecosystem issues that we talked about, the lubrication, the sensation, the engorgement, the elasticity. And there's women that are concerned about the aesthetic appearance.
Cosmetically, what it looks
What
like.
it looks
Okay.
like on the outside, so the outer labia, inner labia, and also the color. In the inner labia, they get more like gray, blue kind of color as opposed to that rosy, youthful pink after babies and as we age. Okay, and women are concerned about that.
What are we in for?
Yeah, tell us.
So the treatments for vaginal health and vaginal wellness that are available today, I'm going to talk about the minimally invasive one. There's two modalities, either with laser, light, or radiofrequency heat. The one that we were talking about today involves radiofrequency heat, a procedure called Votiva, a treatment that helps to restore and enhance vaginal health and wellness. It helps to improve the tightness of the vagina in terms of Kegel strength. And also when I say tightness, I'm not talking about like choking scar tightness. I'm talking about like the pillowy, puffy of like a 4-year-old's cheek, you know, fullness. When I do the treatments, we do them on the inside, so entirely around the circumference of the vagina, okay, in and out. Some of the other treatments that are available only focus on the opening, so tightening that area. The Votiva is throughout the whole length, the 7 to 11 centimeter length of the vagina. So this is what the wand looks like, right? So this is the probe that goes vaginally. 7 to 11 centimeters in length, you can see exactly 11.
Yeah.
So this is the normal length of a vaginal canal.
Wow.
And you can, these 3 silver dots are the electrodes. So this is where the heat is elicited and released. So if we were going to do her, where I'm applying pressure, the heat penetrates exactly in that area with full penetration, full thickness depth. So we can treat the whole length of the vagina, and we can treat the outside. We talked about the labia, the outer labia, the labia majora, and the inner labia, and then also around the clitoris, the G-spot, and around the urethra.
Is this something that you do once a month, once a year, or does it just depend on what kind of a result you want, or will you feel different after one time?
That's a good question, because the way that all of the research has demonstrated, 3 treatments are required to get the best effect and the longest lasting effect.
In places like France, they actually offer physical therapy for your vagina
Postpartum?
postpartum. So they send women to these therapists to work on their Kegels and to
Leave it to the French.
I know, they always, they get it right, man. They do in a lot of ways.
This is what I was told and what I researched.
You know, they tell you, I know they've told you, they tell me to do Kegel exercises, you know, before.
Right.
But once you've delivered a 9-pound, 8-ounce baby, you know, the Kegel is like, I can't even, like, I don't even know what a Kegel, there's no Kegeling.
In case you guys don't know, the Kegels, I've been told, are when you try to stop yourself from peeing. Am I right?
So it's the pulling up, squeezing. If you're having to have the urge to urinate very badly and you're holding. You're not using your abdominal muscles though. It's very important that you're just squeezing the pelvic floor muscles. So that's another cool thing about this treatment is that it restores and improves pelvic floor strength and tone, enhances sexual function, sexual sensation during sex.
For both you and the male.
Both you and the partner, and also improving Kegel strength helps improve urinary symptoms.
I mean, it doesn't hurt, right? Like, what's the...
You feel heat, and on the inside it does. So the inside of the vagina actually doesn't have sensation like heat and cold. It feels pressure and traction. So that's why stretching hurts and pressure hurts. What people feel is either the probe going in and out, the pressure of the probe, which is tolerable, but on the outside with the heat, they'll feel heat and temperature. And we do the treatments based on what the woman can tolerate.
So wait, we're about to get this done. Anything that we should know about the treatment? Like, we got some instructions, like not be on our period, make sure it's hairless, right?
For the outside,
Yeah.
it's smooth contact with the skin, so we're dealing with the outside, also that you're shaved or waxed.
And then you just go home and you're good. You don't have to do anything afterwards. No creams, no taking anything.
Cream, that's it.
It's that easy.
So easy.
All right,
I'm
well, you ready to get
excited.
tired? You
Yeah.
ready to get
Go,
tired?
girl.
All right, it's been a day.
I felt totally fine during and after. I opted to go on a really low setting and not get numbing cream because I'm sensitive, and I guess when it came down to it, I was a little bit nervous because it's, I don't know, a foreign object in my vagina, and I just wanted to start off slow.
You're like, let's go slow for this. I, on the other hand, was like, you know, she offered up the numbing cream, and I was like, well, I guess let's go numbing cream, and then she cranked it, right? She said she went on a high setting.
Might as well if you're numb.
Right?
Yeah.
And I felt, I mean, it's like she said, I felt a little bit of pressure and everything, and I did feel a little bit of heat on the outside. Like a warming pad heat, though, like really, like mild.
Totally manageable. You know, it's a little uncomfortable because you're just kind of sitting there, but nothing you can't handle.
Yeah.
But then by the time she like came to the outside, I was on my phone, and I was like, okay, Instagram, I'm distracted now. You could be here all day, and it's all good. So that was kind of my experience.
Yeah, and like I felt like Dr. Berman really treats it like you're having like a girlfriend conversation. So you start to get a little distracted from what's happening to your vagina.
Right.
You know?
Like a pap smear. I felt completely fine leaving the office. I felt great all night the next day.
Yeah.
You know, some of the symptoms could potentially be swelling or itching, and maybe if you have numbing cream, something like that. I felt completely fine.
Yeah.
So.
I felt like I felt something. I knew something had happened.
But it's really cool because this is a non-invasive alternative
to surgery. It's like Dr. Berman said, women used to have to go get surgery if they felt like they needed some intervention down there. And now they don't have to. So that's kind of awesome.
Dr. Berman charges $4,500, and that's for a series of 3 at her office.
Yep. But the price can vary depending on where you go, where you live, the doctor you see. So definitely do your research and know that that's kind of like a starting point. Big thank you to InMode for sponsoring this episode of the SASS.
Thank you guys so much for watching this episode of the SASS. We hope you loved it. Give it a thumbs up, subscribe, and you can watch another episode of us. Boom.